There is one specific thing that can appear in your bathroom, something you might notice in a matter of seconds and then dismiss entirely, that urologists like me consider a medical emergency until proven otherwise. If you are a man over 60 and you see this sign, you need to stop what you're doing and call your doctor today, not tomorrow. Today. My name is Dr. James Whitaker. I am a board-certified urologist, and I have been practicing medicine for decades. In that time, I have had one recurring, deeply frustrating experience. Men coming into my office who have seen blood in their urine weeks or even months earlier and waited to mention it. They waited because the bleeding stopped on its own. They waited because they assumed it would go away and didn't want to cause a fuss. And in some of those cases, that delay made an enormous difference to their outcome, and not in a good way. Today, I'm going to talk to you about a subject that makes many people uncomfortable, but that I consider one of the most important medical warning signs a man can experience: blood in the urine. The medical term is hematuria, and I'm going to explain to you in complete, clear detail what it means, what causes it, which causes are urgent, and exactly what you need to do if you see it. Let me start with the most important statement I will make in this entire video. Any amount of blood in the urine in a man over the age of 50 should be evaluated by a doctor within days, not weeks. If the bleeding is significant, or if it is accompanied by pain, difficulty urinating, or any feeling that something is seriously wrong, go to an emergency room or urgent care today. Do not wait for a scheduled appointment. Do not watch and see if it clears up on its own. I want to explain why I feel this strongly, because understanding the reasoning will help you act on it. Your urinary system consists of 2 kidneys, 2 ureters, the tubes that carry urine from the kidneys to the bladder itself, the prostate in men, and the urethra. Blood can originate from any of these structures, and while there are many causes of hematuria, some completely benign, several of the most serious conditions that affect men are the conditions most often caught because of blood in the urine: bladder cancer, kidney cancer, prostate cancer. These conditions frequently produce no pain whatsoever. The only visible sign they give you is blood in the urine, and they are the conditions that, when caught early through prompt evaluation of hematuria, have excellent outcomes, and when caught late because a man waited, can be devastating. Now, before I continue, I need to ask you to do something. If you're watching this and you've been putting off seeing a doctor for any urinary symptoms, please subscribe to this channel right now and then call your doctor. I release new medical information every week, but more importantly, none of what I share is a substitute for an actual clinical evaluation. Subscribe and then make that call. And if you know a man over 60 in your life, share this video with him. The information I'm sharing today could genuinely change the outcome of someone's health situation. Let me walk you through the most common causes of hematuria in men over 60, so you understand the full landscape. Cause number 1 is urinary tract infections. UTIs are less common in men than in women because men have longer urethras, but they absolutely occur, and they become more common after age 50 as the prostate enlarges and makes complete bladder emptying more difficult. Residual urine creates a breeding ground for bacteria. UTIs can cause irritation and bleeding of the bladder lining, producing blood in the urine that is typically accompanied by burning urination, urgency, frequency, and sometimes fever. UTIs are treated with antibiotics and resolve relatively quickly, but they always require medical evaluation. And in men, a UTI should always prompt investigation for an underlying cause such as prostate problems. Cause number 2 is kidney stones. As we discussed in a previous video, kidney stones are extremely common and the rates are increasing. When a stone moves from the kidney into the ureter, it can cause significant bleeding as it scrapes the delicate lining of the urinary tract. This type of hematuria is almost always accompanied by severe flank pain, pain on one side of the lower back that can radiate toward the groin. If you have both severe pain and blood in your urine, that is a kidney stone until proven otherwise, and you need urgent evaluation. Cause number 3 is an enlarged prostate, benign prostatic hyperplasia, or BPH. The enlarged prostate has an increased blood supply, and the blood vessels on its surface can occasionally bleed into the urine. This tends to produce small amounts of blood, usually visible as a slight pink tinge, and it can come and go. However, and this is critical, an enlarged prostate producing bleeding always requires evaluation to rule out prostate cancer, which can produce identical symptoms. Cause number 4, and this is the one I want you to take most seriously, is bladder cancer. Bladder cancer is one of the most common cancers in men, and it is the urological cancer most strongly associated with blood in the urine. The classic presentation of bladder cancer is painless hematuria, blood in the urine without any associated pain or discomfort. You might notice it once and it might resolve, and then it comes back. This pattern of intermittent painless bleeding should be treated as bladder cancer until proven otherwise by a urologist. The good news is that when bladder cancer is caught at an early stage, which it frequently is, precisely because hematuria prompts evaluation, it is very treatable. When it is caught late, the outcomes are significantly worse. Cause number 5 is kidney cancer. Like bladder cancer, early-stage kidney cancer frequently produces no symptoms other than blood in the urine. In later stages, it may cause flank pain, a palpable mass, or weight loss. But waiting for those symptoms means waiting for later-stage disease. Blood in the urine is the opportunity to catch kidney cancer early. Cause number 6 is exercise-induced hematuria. Intense physical exercise, particularly running long distances, can cause temporary bleeding into the urine through a mechanism called runner's bladder, where the bladder wall repeatedly impacts the bladder floor during vigorous movement. This is generally harmless and resolves with rest. However, exercise-induced hematuria should still be evaluated to rule out other causes, particularly if it occurs without an obvious exercise explanation or if it persists. Now let me tell you something important. There is a condition called microscopic hematuria, blood in the urine that is too small in quantity to be visible to the naked eye, detectable only through a urine test. This is often found incidentally during routine blood work or a physical examination. Microscopic hematuria in a man over 50 also warrants urological evaluation, because the same spectrum of causes applies, and because the fact that you cannot see it does not mean the underlying cause is benign. Please right now leave a comment below. Have you ever experienced blood in your urine? Did you get it evaluated? I want to know, and I respond to comments because this is exactly the kind of conversation that helps men take their health seriously. What should you do if you see blood in your urine? Here is the exact protocol. 1. Do not panic, but do not dismiss it. Stay calm and commit to taking action. 2. Note the details. How much blood? What color? Bright red? Dark red? Brown? Did it occur throughout urination, or only at the beginning or end? Was there pain? Have you had any recent vigorous exercise, trauma, or new medications? These details help your doctor significantly. 3. Call your primary care physician or a urologist today, not tomorrow, today, and describe what you saw. In most cases, you will be seen urgently. 4. If the bleeding is significant, if your urine is red rather than pink, or if you have accompanying severe pain, fever, or difficulty urinating, go to an emergency room immediately. 5. When you see your doctor, expect to have a urinalysis and urine culture, blood tests including kidney function and PSA, imaging of your kidneys and bladder, typically a CT scan or ultrasound, and depending on results, possibly a cystoscopy, which is a camera examination of the bladder. I know that last word, cystoscopy, makes many men uncomfortable. I understand. It is not a pleasant procedure, but it is done under local anesthesia. It takes a few minutes, and it allows me to directly visualize the bladder wall and identify any abnormalities. It is one of the most important tools we have for catching bladder cancer early. Do not let fear of the procedure deter you from getting the evaluation that could save your life. I am Dr. James Whitaker. Please subscribe to this channel and share this video with the men you care about. One conversation about a topic like this can change a life. I will see you in the next video.